TAVR, or TAVR, stands for transcutaneous aortic valve replacement, which is a procedure that usually is done as an open procedure surgically, where we actually go through the breastbone and the sternum. Now, with new technology, we're able to do this with catheters and wires through the skin.
Traditionally, aortic valves were replaced by our surgeons through open means. This is a procedure that is more catheter-based, where the valve is being replaced in a much less invasive manner. This procedure has been in the U.S. for some years now, but really isolated to bigger medical centers. We've now been able to offer it here, and we're excited that really there's no other place west of that I-35 corridor, Austin, Houston, Dallas, outside of Lubbock. Really nowhere else in West Texas is offering this procedure.
The aortic valve, which is the valve that really connects the heart to the rest of the body, when that valve becomes stenosis or doesn't open well, their prognosis is worse than most advanced cancers. So it really is a deathly disease. Initially, this procedure was limited for people who had very high risk for surgery, but now the indication is broadened because this device and this technology really has such great outcomes. So even people with moderate risk, and in the future people even with low risk, will benefit from this procedure.
The main way this is implanted is through the groin, so the blood vessels in the femoral area. Catheters are advanced up the aorta, through the abdomen, through the chest, and around through the heart. The valve is actually compressed around the catheter in a wire mesh. Looks like almost like a Chinese finger trap, and it's made out of a special metal called nitinol. And so when we release the valve, when we get it where we want it, that metal expands in heat. It opens the narrowed valve, and then the new valve is in place. Then we look at it again on echo to ensure that the valve we just put in is functioning properly. We measure the pressures above and below the valve to ensure that the previous pressure gradients that were there by the narrowed valve are gone. The procedure takes about an hour to 2 hours. Hospital stay is typically about 2 days compared to the previous surgery, which is 5 to 6 days.
Before my surgery, I used to sleep a lot. I just get to my recliner and sleep. Now I got a lot of energy. I can do like my cooking. I do my clothes, hang my clothes outside. I do, stuff that I didn't do before. I feel so good because I was very worried what they were gonna do to me. But whenever he said they can do it on my leg, and under my leg, and so I said, okay, let's go for it. And then by a week, I couldn't, do my walking, cooking, clean all your house. I've been cleaning my house good now. It's giving me a lot of energy to do a lot of stuff. And you know what? They give me medicine just for 1 day. I didn't have to have no more medicine. I do my following appointments with Dr. Haddad, Dr. Hume. They're my angels. My 4 doctors are my angels. Yes.
I had a patient who was one of our first procedures who told me that she's never felt as good in her adult life. So it really goes to what Rudy was saying earlier, that this disease, if untreated, leads to death. And so we're giving these people an opportunity to have these new valves with a tremendous amount of benefits in the way they feel, and doing it in these less invasive strategies. That means their recovery is significantly quicker, easier, and they really, what the biggest thing when they come back to is they didn't think they'd get back to their life or the quality of life in such a short period of time. And that's really the advantage and purpose of this procedure.
This really was an amazing thing to be able to replace somebody's aortic valve. And these guys are used to it because they do it regularly, but through a chest. But as an interventional cardiologist, to be able to do that through a very minimally invasive approach, to me is probably one of the most rewarding things I've been able to do thus far in my career.